is Dr. Idenji Gitahi, and I'm the Group CEO for mHealth Africa. LEAP is a revolutionary training platform for health workers. Note that I did not say app. I did not say mobile app. It's a platform. LEAP has been developed in conjunction with Accenture Foundation, M-Pesa Foundation, and mHealth Africa, and has been developed to specifically create a solution for training of health workers from wherever they are on a mobile phone. Noting that in countries in Africa, in Kenya specifically, penetration of mobile phones is way above 90%. And that means that you can then create a platform where you can reach health workers and train them continuously wherever they are without having to get them to a classroom or whether they, where there's a laptop. So LEAP is basically revolutionary, and it is something that will change the landscape of training of health workers in Africa and in other continents as well. From my interaction with it, I think the biggest benefit is the fact that people can learn as they go. It is basically learning on the go and learning on the screen which you have in your hand. It is a tool of our time. We know that we've had a huge effort on computer learning. But computer learning requires somebody to sit somewhere, there is electricity that you need to plug in your computer. If it's a laptop, you need the gadget. LEAP removes all these things. LEAP says we can train you on your mobile phone, on the go, wherever you are, anytime. And the second thing is that it allows us to train people without having to take them away from their area of work. The third thing is that it keeps the content on the same gadget they are having, and therefore they have a point of reference, continuous reference, without having to open websites and things and like that. So they have a place where they can refer to all the time. The other thing that we've seen is obviously the ability to interact within LEAP with peers, so that learning is not one way. Learning is two way. So you're sending the communication, you're sending the information, they can ask questions, not only with the trainer, with the training module, but also within peer-to-peer. They can actually ask each other, because within LEAP, you can create groups of peers to talk to each other as well. So these are some of the advantages that are there in LEAP. Health workers, as you know, Africa has a big shortage of health workers. And I'll focus on Africa, because that's where mHealth Africa is working. We know that we have a huge shortage. We know that Africa has 25% of the global burden of disease, but only 3% of the global health workforce. That gap that we have needs to be filled. Most importantly, needs to be filled fast. Now, for us to fill it fast, it's going to be very difficult for us to do that if we have to expect everyone to come into class and to get training. So the use of the mobile phone as a tool for training without requiring people to have smartphones and using their normal analog or feature phones is a big leap forward, to borrow the word from LEAP itself. And therefore, LEAP provides us the opportunity to accelerate training of health workers in Africa, not first and most importantly at the community health level, which is level 1 of healthcare, which is a community health unit. So training those using the mobile phone is a big advantage. Secondly, training even other cadres of healthcare in emerging diseases, in what is new, in emergency cases, is a very important feature of it. And finally, merging this training with also syndromic surveillance, and having these same people use their feature phones and their learnings and what they have learned to also look out for any signs and symptoms that may arise that may indicate a syndrome or an epidemic in their communities. And then also informing others. As I said, you can form communities within LEAP, and therefore informing each other and asking, have you seen the same thing? Checking with their supervisors, what does this mean to us? So there is a big opportunity to actually leapfrog training of health workers in Africa through LEAP. With LEAP, we have very high completion rates, above 90% of all the people we train. And these are people being trained and they're not face-to-face, they're in their communities. That tells you that the level of engagement is an incentive to complete the training. So the completion rates are very high. The second thing is that the pass rates are very high. So we find a lot of people passing, and it's likely because they're able to interact with the content continuously without having to write notes. It's a continuous thing because LEAP uses largely two ways. First is text, The next is voice recognition. So that interactivity ensures a very high pass rate and a very high completion rate. But beyond that, there is the effect on the health, we want health outcomes as well. So within the areas that AMREF Health Africa has tested, we have seen increase in the number of women attending at least 4 antenatal visits during their pregnancy. We've seen increase in the number of women delivering under skilled attendants, and we've seen increase in the number of children receiving immunization. That is documented in AMREF. And what we've done now is to say, why don't we work with the Ministry of Health in Kenya so that we have independently verified data? And that is what is going on right now, and we'll be sharing those results as we come along. But we've seen increases in health outcomes, which has made us believe that actually it is an effective way of training community health workers who we have been working with so far. The future of LEAP is bright. The future of LEAP is the future of healthcare, is what I'd like to say, because as I've just said, the biggest gap that we have now is health workers. So you have communities that have a right to health, but there is a gap of access in the existing system. That gap could be infrastructure. There is no road to get to the hospital. That gap could be language, that the health worker you find in the nearest health center does not speak your language. That gap is culture, that many people may fear to go to the health centers because health centers are by design in the urbans, in the shopping centers, in the more developed areas of the community. That gap could be financial, that I don't have transport to go to the hospital. That gap can be filled by creating an army of health workers, which is what we call community health workers, who are people who belong to the communities, close to the communities, and understand the community. That means that once you create those people, then you increase the number of people who have access to health workers. Now, for you to create that army, these are people who do not need to be plucked out of their community to be taken to a college to be trained. Therefore, LEAP then is the way to fill that gap, to train them, and not only to train them, which is what happens when you do face-to-face. You take them away, they are trained, then they go back with notes. LEAP allows us to train them continuously, engage with them continuously, even beyond the training, and also allows them to create communities of practice, more or less, or these group chats within peers, that therefore they can continue peer-to-peer learning, and therefore you don't even need refreshers with LEAP. LEAP is a refresher in itself. It keeps refreshing the knowledge and giving people the information that they need.